Now, other than technology, what is new about this survey compared to the previous one?
There are a number of things that are new. First thing is the scale of the study is much larger now than it was before. We're contacting about 13,000 families. Another important element of the study is that we're looking specifically in smaller communities. So there have been about 180 selected across the province. We're very much interested in the impact that communities and schools have on supporting child mental health in the province. We're looking at linking information collected in the study with experiences with the healthcare system and the responsiveness that the system has to kids' mental health needs.
Now, you mentioned the smaller communities, there are 180 communities. Why smaller communities?
Well, if you want to understand differences between areas or geographic areas or communities in the responsiveness to mental health needs or levels of mental health needs, then you have to sample at the local level. This is quite unusual. Most studies sample broadly to get broad estimates of mental health needs in a population. We're going to get those overall estimates as well, but we're going to be able to look at differences between smaller communities in these levels, and we believe that will provide us with important insights about the factors that affect child and youth mental health.
I would say that, back when you did that first study was done in 1983, mental health really didn't have a lot of prominence. It's changed now that it's a lot more people talk about it, right?
It's changed dramatically, and I think the Mental Health Commission of Canada has been instrumental in the past 7 or 8 years to bring attention to mental health as an important issue to be reckoned with in the country and in the province itself. And of course, the media itself has identified a number of issues associated with mental health in the population as well.
Now, so is it just mental health that you're looking for in this study, or is it more broad-reaching?
No, it's much more, it's broad than that, because we're interested in chronic physical illness, for example, and the relationship between mental health and chronic physical illness. We're also interested in academic achievement, social functioning amongst kids as well, and its relationship to those phenomena. And of course, we're interested in family characteristics and neighborhood characteristics and school characteristics too. So it's a pretty broad survey. We're covering a lot of different areas.
And you're not just talking to parents, but you'll be talking to the kids themselves and teachers as well?
Absolutely. So parents, of course, will be critically important to it. We're asking what's called the person most knowledgeable, which is usually the mother, but we're also going to ask for information from spouses. We're going to be collecting information directly from adolescents aged 12 to 17 and from teachers of children in elementary school as well.
Now, is there any specifics about who can participate?
The families will be randomly selected based on information that Statistics Canada has. So it's a selected survey, and we're really hoping that people that are contacted by Statistics Canada to participate in this study will say yes to participation. So it's not a voluntary study in the sense that people coming forward. It is based on what's called a probability sample, trying to get a representative sample across the province. It's critically important for us to get actual and accurate estimates for people to participate in this study.
For those that you would like to take part in this study, what kind of commitment are you looking at?
Well, it's a fairly large commitment. I have to be straightforward about it. I think, and the commitment will depend on family size. For example, we're interested in including up to 4 children in the family if there are 4 children between the age of 4 and 17. So many families with 1 or 2 kids, the interview time is going to take about an hour and a half, maybe a bit more. The interview time, or I'll call it the data collection time for adolescents, is about 30 to 35 minutes or so, done by a computer-assisted questionnaire.
So it's not all that labor-intensive then?
Well, it depends. We live in such a busy and hurried age. People's time is very valuable. So it is a fair bit of time, but I don't think it's excessive. And I think the important thing is the yield or the benefits that the survey can do for kids. We really think that it'll provide us good information about the levels of mental health need now in comparison to what's especially important is the relationship between, for example, socioeconomic disadvantage and mental health. We're hoping that that relationship has been muted or gone down in the past 30 years, but we're not sure because of growing income inequality in the population.
When do you expect to have the results from the study?
Well, the study is data collection will be completed next May or June 2015, and it'll take another year or so for the information to be sort of marshaled and analyzed and the reports coming out. So it'll be in 2016.
All right, so we've got a bit of a wait to see the results then.
That's correct, for sure.
All right. Doctor, I want to thank you for joining us this morning. Appreciate it.
Thank you.
All the best. There goes Dr. Michael Boyle. He's the principal investigator for the Ontario Child Health Study. The first one was done in 1983. And after the results came out, more than $3 billion was invested by the federal government in terms of child care and learning and teaching best practices, I guess, for raising children. So here we are, 20 years later. Look at the difference from 1983 to 2014. Technology is the first thing that comes to mind. There was no cyber